Hook and opening 3060 sec narration. OPK Guy Ki Sahat, OPK Kandan Ki Rosi. Lekin Shwati Sigalti, Baribay Marika Sabab Bang Shukti Hai. Ajhum, Complete Guide, Dean Whale Hain, Common Diseases, Unki Pechen, Bako, or First Aid Ta. Opika Herdstrong, Rehi Dude, Ziada Ho, or Nuxan.com. Visuals. Healthy herd B-roll gives quick flashes of fever, tick, runny nose. Swollen udder gives back to smiling farmer, promise. End, tack, decline hum, up, KOEK 7-step daily health check. Season-wise, prevention calendar, or emergency action plan BDEN. 2 quick anatomy and immunity basics for context. Ruminant system rumen, reticulum, omasama bumasam, abumsum impacts feed, digestion, and disease signs. For example, bloat, acidosis, temperature, Y. A minus 39.1 degrees Celsius, I minus 102.5 degrees Fahrenheit. Heart rate, Y, YBPM. Respiratory, rate 26 to 50 per minute, calves higher. Rumen motility, 1-2-3 contractions, 2 minutes. Immunity, colostrum in first 2 to 4 hours of life is vital. Stress heat, transport. Poor feed depresses immunity. 3. How diseases spread. Farm reality, direct contact. Nose to, nose, salivea, milk birth, fluids. Vectors, ticks, mosquitoes, flies, ESP, 4-LSD, anaplasma, thylaria, fomites, buckets, ropes, milkers, hands, needles, ear tags. Environment, wet bedding gives mastitis. Stagnant water gives up, muddy yard gives foot problems. Purchases. Bringing in new animals without quarantine is a top risk point for red flag signs. You should never ignore sudden, high fever, 40.5 degrees Celsius, not eating, drooling, grinding teeth, sunken eyes, dehydration, nasal discharge, cough, open mouth breathing watery, foul diarrhea, blood and stool, calves ESP, swollen udder, clots in milk, pain while milking, nis, swollen joints, hoof cracks, foot rot, smell nervous signs, circling, head pressing, incoordination, aggression. Abortions, retained placenta greater than 12 hours, foul discharge, sudden drop in milk yield, change in rumen movement, bloat rule. If 2 or more signs appear together, isolate and call the vet. 5. Infectious diseases. By category 5.1, viral disease ASA, foot and mouth disease, FMD signs. High fever, drooling, mouth ulcers, lameness, blisters on tongue, hooves, teats, sharp milk drop spread, extremely contagious, via aerosols, saliva, milk equipment, humans' clothes, action, isolate, soft feed, pain control, per vet, strict hygiene, vaccination, per regional schedule. B. Lumpy skin disease, LSD signs, firm nodules on skin, fever, swollen lymph nodes, edema of legs, milk drop, may cause pneumonia spread, mainly biting insects, also via secretions. Action, vector control sprays, porons, shade, antibiotics, for secondary infections per vet. Vaccination campaigns. C. Bovine, viral diarrhea, BVD signs, fever, diarrhea, immunosuppression, abortions, PI persistently infected calves, spread virus. Lifelong action. Test new stock. Copias, vaccinate where recommended. BIOSECURITY. D. Infectious bovine rhinotrades IBR signs, fever, red eyes, conjunctivitis, nasal discharge, cough, infertility, abortions. Action, vaccination programs, reduce stress, isolate sick. E. Rabies, signs, behavior change, aggression, or paralysis, excessive salivation, fatal action, emergency, quarantine, avoid exposure, vaccinate risk, herds, post-exposure protocol for humans. 5.2 Bacterial disease, mastitis, contagious, and environmental signs, hot, swollen quarter, flakes, clots, in milk, reduced yield, subclinical, SCC, risk, poor milking hygiene, wet bedding, teat injuries. Action, strip cup test, CMT, vet-guided intramammary, antibiotics, post-milking teat dip, dry cow therapy, milking order. Healthy gives subclinical, gives clinical, gives treated last. B. Brucellosissins, late-term abortions, retained placenta, infertility, or chitis, in bulls. Zoonotic, action, test and remove policy per law. Vaccinate heifers where approved, pasteurize milk. Farm staff PPE. C. Leptospirosissins, fever, jaundice, red urine, hemoglobinuria, abortions, spread by urine and water. Action, rodent control, clean water, vaccination per region, antibiotics per vet. D. Anthrax signs, sudden death, bleeding from orifices. No higor mortis. Action, do not open carcass, notify authorities, proper disposal, vaccinate in endemic zones. Tuberculosis signs, chronic weight loss, cough, zoonotic risk via raw milk. Action, testing, Culling policies. Never sell raw milk from suspect cows. F. Clostridial diseases, blackleg, tetanus, enterotoxemia, signs, sudden death. Muscle swelling, blackleg, stiffness, tetanus, diarrhea, enterotoxemia, action. Multivalent clostridial vaccination, wound hygiene. 5.3 Parasitic diseases, external parasites, ticks, lice, mites, flies problems, anemia, skin irritation, disease transmission, anaplasmosis, filuriosis, babesiosis, action, strategic porons, sprays, rotate actives, pasture management. Treat all animals simultaneously. B. Blood, parasiticina plusum, fever, anemia, weakness, yellow eyes. Treat per vet. Vector control, babesiosis, red water, high fever, red dark urine, anemia, tick control plus vet therapy. Theileriosis. Fever, enlarged lymph nodes, respiratory distress. Requires specific antiprotozoals per vet. C. Internal parasites. Worms, flukes, signs, poor growth, diarrhea, bottle jaw, facilla liver. Fluke causes weight loss. DECREASED. Milk. Action. Drench strategically, rotate dewormers, fecal egg count checks. Avoid wet grazing. 5.4 Fungal and yeast ringworm dermatophytosis. Round scaly hairless patches. Zoonotic potential, clean. Reduce crowding. Yeast, mastitis, post-antibiotic imbalance. Confirm lab culture. Follow vet protocol. 6 Non-infectious and management diseases. 6.1 Metabolic and nutritional. Milk fever, hypocalcemia, post-calving, cold ears, downer cow. Action, vet for calcium. Prepartum DCAD diet, low cup pre-fresh. Oral Ka gels, post-calving, ketosis, fatty liver, off-feed, sweet breath, low milk. Action, propylene glycol drench. BCS control target 3.0 to 3.25 at calving acidosis. Sera grain overload. Loose manure. Action, effective fiber, buffers, gradual diet changes, bloat, left flank distension, discomfort. Action cue, bloat, agents. Trocard, in emergency by vetmenish legumes, 6.2, lamines, and hoof. Disorders foot rot. Digital dermatitis, laminitis, action, regular hoof trimming, 2 per year. Clean lanes, foot baths per vet, balanced rations, comfortable flooring. 6.3 Reproductive disorders, retained placenta greater than 12 hours. Metritis, endometritis, repeat breeding, PROLAPSE. Action, clean calving pens, adequate minerals, CUP-E, SE, VIT, E, energy balance, timely vet treatment. Avoid pulling calf to early 64, toxicizureia. Ammonia, nitrate in forages, mycotoxins, poisonous plants. Action, test feed, proper mixing, binders for mycotoxins. Avoid sudden ration changes. 7 Calf diseases, birth to 6 months, 7.1 Neonatal diarrhea, scours agents, E. coli, rotavirus, coronavirus, cryptosporidia. Signs, watery diarrhea, dehydration, sunken eyes. Action, fluids first, oral electrolytes 2 to 4 times day. Continue milk, hygiene. Vet antibiotics only when indicated. 7.2 Pneumonia complex, risk, poor ventilation, cold stress, overcrowding. Signs, cough, nasal discharge, fever, rapid breathing, action, draft-free ventilation. Dry bedding, group by age, vaccines per program. Vet treatment plan. 7.3 Navel and joint ilcos, bacteria entering via umbilicus. Action, dip navel with iodine at birth. Clean calving area, early treatment if swelling. LAMENESS. 7.4 Coccidosis, older calf signs, bloody diarrhea, straining, weight, loss. Action, coccidiosis in feed water, as advised. Sanitation, avoid overcrowding. 8 Biosecurity, keep disease out and in control. Quarantine new or returning animals for 21 to 30 days. Test for key diseases, clean and disinfect high-touch gear, separate milking towels per cow, foot baths for staff, vector control, ticks, flies, mosquito. Schedule porons, clean stagnant water. Use screens, traps. People flow, visitors track log, restrict entry to calf pens and maternity. Manure and dead stock compost, manure management, APP, ROV, ED, carcass disposal. Never open sudden death animals. Records, health logs, fever dates, treatments, withdrawal times, training, staff SOPs and local language. Yearly REFRESHERS. 9 Vaccination general principles. Follow regional veterinary guidelines for FMD, LSD, HS, hemorrhagic septicemia BQ, blackwater, brucellosis, clostridials, IBR BVD, where applicable. Cold chain is critical. Never use expired vaccines. Record batch/expiry/site. Vaccinate heifers pre-breeding for reproductive pathogens per vet plan. Observe withdrawal times and post-vaccination reactions. Tip: create a wall calendar. Pre-monsoon vector control. Pre-winter respiratory. Focus. Pre-calving transition health. 10 daily 7-step health check. 2 minutes per cow. Observe appetite and behavior alert. Chewing cud. Check nose, eyes, ears, discharge, droop. Look at manure, consistency, blood/mucus. Closing parenthesis. Watch, breathing effort, cough, inspect. Udder and milk heat, clots. Feel rumen fill and left flank shape bloat. Feet and gait limp, hoof lesions. Log any abnormality in the health diary. 11. First aid and triage. What to do before the vet arrives. Isolation pen with shade. Clean water, easy feed, hydration, oral electrolytes for diarrhea. For fluids only. By trained hands. Fever pain? Use only vet-prescribed anti-INF-LAMMATORIES. **** mil.